Morning, morning, morning. Taxi Chronicles here. So I want to talk to you about the NHS. Yes, yet again, NHS. Give you my personal experience. I had rickets as a child. I was 6 months, and rickets is a disease or an occurrence that you get when you do not have calcium, vitamin D, and that you get through your mother's breast milk and being in the sun. Being in the sun, I stress, is where we've had the lockdown and lots of children were kept indoors for a year to 2 years. They were vulnerable to rickets in that case. Now, I'm a big guy, I'm quite strong. I'm not as strong as the rest of my family, but I thank God for the NHS because it took them 6 months to nurse me back to health. Rickets meant your bones grew the wrong way and deformed and all those things. So that's why it took so long to get back to health. Now, why I'm talking about this, because I believe in the National Health Service. I believe in it to my core. I believe that we shouldn't really need the privatisation of healthcare. I think you could have private companies who do innovation in medicine, but generally, NHS, we need it. And that should be the be-all and end-all. Yeah, it can be improved in the sense of structure, moving things around, population, societies are changing, our societies are changing, things like that. I spoke to a rider one time, he's from America, and he's talking about his experience of the private health service that they get in America and the national health service that we have here. Now, he said when he explains to his colleagues or friends, acquaintances, family members in America, he says, listen, you guys have private healthcare and you feel comfortable. But the problem is, if you get any chronic sickness, if you haven't ticked a box or you missed a box or you didn't put something down or you put something down, they will stop your claim. Regardless of all the money that you've paid, they will take that money and they'll just forget you. And then you would have to find the money yourself. You'd have to remortgage your house, do whatever you have to do. Steal, kill, whatever, to be able to get the operation, whether it's for you or your loved one. He said in England, what they've got, the government's just turned around and said, listen, we're not going to bother with the private healthcare insurances. We are your insurance. We will make sure everybody gets covered. Everybody will pay money into there according to their amount that they earn. And therefore, if you are sick, we'll guarantee you get served. So he asked them, which would you rather? Begrudgingly, they said the English. But I think that's a really good story. Not just because you could say I'm a patriot for England or, Britain in that sense, but it makes sense. Everybody can relate to that. So my question to you guys is, do you think you're better off paying for private healthcare?